Hello everyone and welcome into another Joint Movement DPT's video. My name's Dr. Ryan. This is my lovely wife, Dr. Megan.
Hi.
We're both doctors of physical therapy and more importantly, we're travel physical therapists, which is probably why you're here. And so if you're new to the channel, thank you for showing up and watching our videos.
Today we're going to talk about how to navigate the anxieties that come with travel therapy.
And there's quite a few. So let's jump in. Some of the anxieties that people have emailed us about and even that we have can be things like going into a setting that you're unfamiliar with, whether that's outpatient, inpatient, skilled nursing facility, home health.
Yep.
You know, just being in an environment that you're uncomfortable with because you haven't worked maybe that much in there or at all. Another thing would be anxiety over meeting new coworkers. As humans, we like interaction with other people, but sometimes when we don't know those people, it's definitely awkward at first, and that can breed some anxiety.
Yeah. Sometimes you even have anxiety about the new town that you're going to. You're not quite sure what it's going to be. You try and get as best of a feel for it as you can, but there's nothing like actually being there. And then another common one is the onboarding and training process. A lot of people are worried about getting thrown into the fire, and rightly so, because as a travel physical therapist or as a travel health professional, you're there to help the facility and come in and fill a need that they have right away. But there's a couple things that we do to help navigate that situation to make it set up for our success and to lower our anxieties.
We totally get where you're coming from.
Yeah.
Because we have the same worries, concerns, and honestly, it boils down to fears that you all have and have written to us about. And the best advice we can give you is the truth. And that truth comes from our personal experience. And really that is, the anxieties never truly go away.
No. You know, we get that new job, new facility, new coworkers, new town sense of anxiety every time we're about to take a new contract.
Yeah, and that usually lasts, I would say, probably anywhere from 1 to the first 4 weeks.
Yeah, because you're going into a lot of change. You're changing your location, you're changing your job, sometimes you're changing the setting of your job, you're meeting new people. That's a lot of change, and it's normal to feel anxiety over that. Now, through travel, it has definitely subsided. We've realized that we have certain strengths. We've realized that going through this process has strengthened us in ways where all of this becomes more familiar to us and we're able to make these changes. So while it never goes away, I think we definitely feel a little more confident each time because we are getting familiar with the process and we know that we've been successful in the past.
Right. You feel more comfortable with change.
Yeah.
But after those first initial uncomfortable weeks and rising up to new therapy challenges, which might include us learning a new skill or maybe just brushing up on what we already know through our textbooks or the internet, and that kind of initial part of where we're searching for our rhythm in this new place, this new environment, we find that after that initial stage of awkwardness and uncomfortability, we actually find that our confidence comes back and at times even stronger. We feel that our therapy skills in this uncomfortable setting improves, and then now we have the confidence to go work in that setting and work in multiple settings and feel needed in those areas, and that we can truly help patients in different processes of their rehabilitation.
Yeah. Sometimes that feeling of being uncomfortable is just your therapy skill set being refined and gaining new strengths. With that being said, you ultimately have the final say of where you end up taking a contract. So if there's a contract in the pediatric population, which is kind of rare, but you don't have any experience and you don't feel comfortable, you can pass on that contract. We do always suggest to be flexible, especially during COVID, either with your setting, location, or pay. But be confident in your therapy skills. You know a lot, and a lot of it will transfer across settings.
Yeah, I think you'll be surprised. I know we were surprised on, like, my first travel therapy contract was in home health. I had very minimal experience on my clinicals in home health, like 2 Fridays out of my whole clinical experience. But it was surprising to me how quickly my skills transferred over into that really unique setting.
Another way we navigate through our anxieties is leaning on each other. And it's definitely okay to have a buddy that helps you through times of a lot of change. And so sometimes it's just letting each other talk out the day or talk out their anxieties and reminding them of how smart they are, how much schooling they went through, how much they really help their patients. And so those little words of encouragement can mean a lot. So that's an advantage that teams have. And if you're traveling as a solo traveler, you can always keep in contact with somebody at a permanent job, one of your friends from school. Maybe you keep in contact with a professor that you really connected with and that helped you learn the material. So family and other travelers.
I know we also lean on family quite a bit. And so having a good family member to just give you some support, maybe that simple phrase of "you can do it," I mean, look how smart you are, that can really make a difference. And so that would be our advice for solo travelers.
Yeah.
And I know personally that's what we lean on, each other and family. And that really helps with our anxieties when going into a new contract. Let's go ahead and get into how the first couple weeks of a new contract works. We get asked this question quite a bit. Mostly it's rooted in anxiety of unsure if the onboarding process or the training is going to be adequate or if it's going to be, you're just thrown in with a full patient care load, a full patient caseload, and you're, thrown into the fire per se. How we answer this is it depends.
Yeah, it can change facility to facility, contract to contract, but we have a few questions that we always make sure to ask during our interviews.
Yes, and this is the interview when you're interviewing with the facility, whether that be the clinic manager at a hospital or an outpatient place. This is when the interview when you're going to want to ask these questions. And it works a little different than a permanent job interview. Which I think is an important point to bring up. In a permanent job interview, you're trying to win that job and you're trying to impress this employer. But with these interviews, really the facility really wants you and in a certain sense needs you. And this is your time to ask questions about their facility, their operation, their hospital. How does their therapy department run? During
this interview process, there's a couple questions that we always make sure to ask. And as we said, this is the time to do it. So a few of those questions are, what does your onboarding/training process specifically look like?
Yeah, and make sure you ask specifically what it looks like because they might just say, well, it's just 2 weeks or it's 1 week. But ask the nitty gritty. So does that look like, okay, I'm going to shadow another therapist? Does it look like I'm going to slowly increase my patient caseload and how many? This is the time to ask those questions to really kind of get a baseline of what does it look like and then how much leeway there is. So is it a hard 1 week, you better be ready to go? Or is it look like, well, we'll go for 1 week and if you're feeling confident, then we'll roll into the next week. If you're not, then we'll extend it a little bit.
Yep, and you can kind of get a feel for how the management would like you to perform based on their answers. It's also good to ask what is going to be expected of you as a full-time therapist who has been oriented. What is your patient caseload?
Productivity level, how many visits you're going to be seeing a day, just to kind of get an overview so you're not shocked once you get there. Another question we like to ask is, what does their staff look like? How many other therapists do they have? And this is important because you're going to have more questions even after that training period. And it's good to know that there's some coworkers around there that you can lean on and be like, hey, how do I do this in the documentation system? Or where is this supplies at? Just some of those questions that aren't really even therapy based. It's more of like, how does this facility operate? And so knowing what therapists are there, How long have they been working there is an important one to ask. What help do you have? So we're physical therapists, so we always ask, is there OTs there, home health aides like in home health, speech language pathologists, PTAs for us, some assistants.
Mm-hmm.
And those are good things to know, so you have this sense of being supported and know that support system's there. And that just makes it a little bit easier to hop into right off the bat.
In our experience with onboarding processes, we have had plenty of time to train. We have had wonderful therapists paired with us to bring us through the process. And we've had management who was comfortable with saying, do you need more time on this, or are you ready to go? So the communication with management each time has been great, and that's a huge thing for anybody in any situation. Keep that communication line open with management and let them know how you're doing.
Yeah, sometimes when you hop into a new situation, like a new travel contract, you almost don't want to ask questions because you don't want to seem like you don't know what you're doing.
Yeah.
Inexperienced. But we would say, ask the questions, especially to your fellow coworkers, so like to other therapists, because most likely they brought in a traveler because they've been short-staffed, probably overworked, so they're really excited for you to be there and to help out. And they know you're going to have questions because you're new, everyone's new there. And I think sometimes we think travel jobs and permanent jobs are different in that aspect, but both know that you're new to the facility and you don't know where things are and how their operation works.
We have definitely felt comfortable by the end of our training every single time. We never felt like we were thrown into the fire. We always felt like we could ask questions and get answers and do our job well. So that's just a testament to being travel therapists. It does not exclusively mean that you are going to be dropped into the deep end and they're going to test and see if you can swim.
Right. And that's why it's important to have good recruiters. So recruiters who won't send you somewhere that's going to throw you in the fire. And then that's why it's so important to ask those interview questions and really sniff out the place and see, do I want to work there? Because if there's some red flags going off where like their productivity is a whole lot and their training is 1 to 2 days and they're like, you better figure it out.
Right.
When you start seeing those red flags, then that's the moment to say, you know what, I don't want to take this job.
Yeah.
Okay, recruiter, we're going to look for something else. This just wasn't a good fit.
Right. You just want to make sure you're setting yourself up for success, and these are important things to do in order to end up in a good job with a good experience.
When we first started looking into travel therapy, we told ourselves that first travel contract will only be 13 weeks. And for us, we could do anything for 13 weeks.
Yeah.
Is essentially like one of our clinical rotations.
Even amidst all this anxiety talk, even if the anxieties got the best of us and travel therapy really wasn't a good fit for us, our personalities, for whatever reason, it was only 13 weeks, and that gave us a lot of comfort. We knew we had already done 3 10-week rotations as students, and we got through those. So we could for sure get through 13 weeks as a new therapist, learning from new therapists out in the world, getting paid for the first time. And so that really did ease a lot of our anxieties.
And then we decided that at the end of that first contract, at the end of 13 weeks, then we would sit down and decide, is travel for us, or would we rather just move back home and find permanent jobs? We understood that we would feel comfortable and we could do the permanent jobs back at home as we had been doing those for clinicals pretty locally around home. So we knew we were comfortable in that setting. And I think it's real easy to stay where you feel comfortable.
Yeah, for sure.
But what we didn't know is what opportunities would travel open up to us. We felt that stepping outside of comfortable or the normal was a small risk compared to the payoffs that travel therapy could offer to us. And we've enjoyed it ever since.
Yeah, we've been loving travel. We have plans to continue traveling. So we hope that this video encouraged you. If you're feeling any of the same anxieties that we have, in the past and in the future that I know we'll have. If you liked this video, please like it, please subscribe to our channel, and we're so glad that you took the time to be here with us.
And if you have any other questions, put them in the comments below. We try to respond to all those, or email us at jointmovementdpts@gmail.com. And if you're looking for our personal recruiter recommendations, hop on to our website, jointmovementdpts.com, and we have a little thing there where you can click on and fill out, and then we will email back to you the people that we work with and we enjoy and trust.
So thank you so much for joining. Please comment below. Like he said, shoot us an email if you have any questions. We'd love to help. And until next time, see ya.